Today for Laura, we're going to treat the lines across the top of her forehead, and we're going to do that by injecting some Botox into the frontalis muscle. So the frontalis muscle is the muscle that comes all the way across the top of the forehead and is responsible for lifting the eyebrows up. So if we relax that muscle on its own, we'll lose the eyebrow elevation, which would push the eyebrows down. So whenever we're relaxing the frontalis muscle up here, I always put some Botox into these muscles down here, which are responsible for pulling the brows down, so that counteracts the effect of the Botox in the frontalis. So it's possible to put some Botox in here and the frown muscles on their own without doing anything to the forehead, but when we're doing the forehead, we virtually always do some down here as well, because even a millimetre, can I get you to look straight ahead at the camera for me? So even a millimetre or two of depression here, it just starts to make this feel quite heavy in there, which is something that we want to avoid. So some Botox across here, nice, light, gentle dose, so she's still got plenty of movement, and then a few little drops into the frown muscles just to counteract that. So everyone's anatomy is slightly different, and therefore the way that we inject Botox is always slightly different depending on the person. Can I give you a big frown? Can you give me a big frown, please? So the difference of a few millimetres in product placement makes all the difference to the way the result looks when the drug kicks in. So the Botox treatment itself is really fast. It takes about 30 seconds in total, and it's virtually painless. Can you feel that, Laura?
Not at all.
Good. So for injecting Botox, I use these tiny little needles that I get from the Netherlands because they are smaller than the standard needles we get in this country. And by using these really tiny, fine needles, it makes the process much more comfortable. And you can see we get virtually no bleeding, which means no bruising either. So 30 seconds, treatment's done. We've got a few little red marks where the needle's going through the skin. That's going to die down within about 20 minutes. And then Laura is just going to look back to the way she did before, and over the next couple of weeks it's going to gradually kick in. And this time, 2 weeks, the forehead should be nice and smooth, and Laura should be happy with the outcome.
Thank you.
You're welcome.